Stress, a universally human experience. Good stress, bad stress, chronic stress, acute stress. Some of us are experiencing some of that tonight. 35% of the US population experiences excess stress, stress to the point of biological dysregulation, beyond our perceived ability to manage it. Excess stress is socially patterned. And in public health, and stressors that we all experience, stressful life events, daily life hassles, but those who identify as gay, lesbian, and bisexual are more likely to experience excess stress due to homophobia, heterosexism, and other forms of discrimination at all levels of society. This kind of excess stress is referred to as minority stress. Public health cares about socially patterned excess stress because it compromises the basic human right to health. Excess stress is associated with all the leading forms of death and disease, including heart disease and cancer. Excess stress also produces health disparities, or gaps in health, where some people do particularly well physically and mentally, and others do not. That is the case for sexual minority men and women. Data tell us that they experience poor physical and mental health as compared to their heterosexual counterparts. Excess stress in the form of minority stress is the prevailing theory for these disparities. Tonight I'm going to talk with you about sexual minority women, a group who experiences twice the rate of overweight and obesity, elevated cardiovascular disease risk, and greater rates of breast cancer than heterosexual women. And in particular, I'm going to focus on rural sexual minority women. Rural sexual minority women may be at the greatest risk for excess stress and negative health outcomes due to social and geographic isolation, as well as socio-political conservatism. 72% of rural sexual minority women report overweight and obesity as compared to their urban counterparts. So I conducted a study concerning the perceptions of overweight and obesity among sexual minority women, and they told me they don't care about their weight. They don't care about their shape and size. What they care about is stress. They told me they were stressed, partly as a consequence of living in a socially conservative environment. And when we consider the experiences that they faced, it makes sense they felt stressed. These women told me that they'd been called names, terrible names like dyke, faggot. They were told by strangers they were disgusting. People pointed, stared. These findings really suggest that we need to eliminate discrimination at all levels of society. And the best way to do this is with anti-discrimination public policy. Very unfortunately, this isn't possible in many areas around the country, including Tennessee. And so when this isn't feasible, we implement solutions at levels that are feasible, including the individual level. Mindfulness-based stress reduction is one promising individual-level solution. Mindfulness-based stress reduction is a program, an 8-week face-to-face program designed to reduce stress. And you know what? It works. Participants have twice the amount of stress reduction as compared to other behavioral approaches. And it's something that everyone can do, regardless of physical ability, space, and place. And mindfulness is getting a lot of attention in the popular press and the scientific community. In clinical trials, 8-week face-to-face courses with formal, daily, 45-minute mindfulness meditations significantly reduce pain, medication, anxiety, depression, and a host of other mental and physical health problems. According to Jon Kabat-Zinn, mindfulness is really very simple. It involves paying attention on purpose in a specific way to the present moment without judgment. Mindfulness-based training is really about training the mind to focus on purpose to the very moment that you currently occupy. Sounds easy enough, right? You're focused right now. And when I started my mindfulness-based journey, I imagined a spa-like retreat with singing bowls and soy-based candles, aromatherapy and stacking stones, maybe a warmed lavender eye pillow. Quickly, I learned that focusing my mind felt a lot more like sitting on a Ferris wheel on fire than in a spa-like retreat. Allow me to demonstrate. I'm going to count from 1 to 10. Every time my mind wanders, I'll return to 1. This is good. 1, 2. Oh, I hope I don't black out. 1, 2. Was there bubbly at the bar? 1. You get the idea. Mindfulness can be really hard. And it's hard because we have between 65 and 75,000 thoughts a day, 90% of which we had yesterday. 95% of those of no use to us at all. The good news is with training, we can learn to pay attention on purpose, specifically to the current moment without judgment, and this will reduce stress. Mindfulness-based stress programs are traditionally delivered in clinical settings by a trainer, but face-to-face delivery is not always feasible in rural locations. Good news, these programs can be delivered online, and online versions tend to reduce stress by about 10%. A 10% reduction in stress for sexual minority women could be an enormous benefit to quality of life and health. Stress reduction. That's what the women told me they wanted, what they needed. And in public health, we apply empirically tested interventions to solve health problems. Unfortunately, there are no empirically tested interventions regarding the efficacy or acceptance of mindfulness-based stress reduction programs for sexual minority women. So I'd like to introduce to you Project OM. I am now testing the feasibility of an 8-week online mindfulness-based stress reduction program for rural sexual minority women right here in Southeast. The goal of my project is to determine the feasibility, acceptability, and the amount and duration of activities that sexual minority women are willing to complete. To date, 12 women have enrolled in and 6 have completed my online 8-week mindfulness-based stress reduction program. And they tell us they love the program. They appreciate the online flexibility. They are engaged with weekly readings and videos, and more than 70% are completing formal meditations 5 to 7 days per week. And they tell us that they've experienced reductions in their stress. They're feeling less anxious. They're taking less anxiety-reducing medication. They feel better. They tell us they feel good as a consequence of their participation. They also tell us they feel isolated, and they want to engage with other women who are engaged in mindfulness-based stress reduction online. Pema Chodron says that if someone shoots an arrow into your heart, it's fruitless to stand there and yell at them. It's much better to turn your attention to the fact that there's an arrow in your heart. Until it's feasible to eliminate heterosexism, mindfulness may be one way to help sexual minority women attend to the arrow in their heart, and that's a worthy cause.